Do you regret in some sense taking surgery?
Never. My father was a surgeon. So that was the biggest inspiration, seeing him save lots of lives.
Every surgeon I've spoken to has had one case that really influences them.
I'll share two different angles.
There's been an increasing level of medical legal cases.
I have faced this journey myself. Any critical care patients, whatever the first interaction with the relatives is, has to be recorded.
DNB surgery trainees often have less exposure to MS.
The sky is the limit for everybody. It depends on the institution rather than the degree.
The advancement of robotics.
Robotic is just an extension of laparoscopy.
Which super specialty in surgery would you recommend?
Do what you want to do and do what you feel like doing.
Any advice for young surgeon?
Be adaptable to change.
Hello and welcome back to Behind the Scrubs by Knya. Today we are very lucky to have Dr. Arpit Bansal. Dr. Arpit Bansal is from Prayagraj. He's an accomplished laparoscopic and cancer surgeon. In addition to surgery, he also spends a lot of time researching on longevity and is a biohacker. Today we are incredibly lucky to have him, and thank you so much for spending the afternoon with us, Doctor.
Thank you so much, Abhijit. It's an honor. I'm equally excited to be a part of this journey and to connect with young doctors and young brilliant minds like yourself.
No, thank you so much, and welcome to Behind the Scrubs from Kanya. Doctor, let's start by you telling us a little bit about your journey. Why medicine? Why surgery? How you got into laparoscopic surgery, cancer surgery?
Perfect. So, thank you for your kind introduction. So, I am a laparoscopic cancer surgeon. For our audience, I would let you know. And my journey starts. So, when I was a kid, my father, mother, both were doctors. They started one private hospital named of Jeevan Jyoti Hospital. In that era, when Allahabad city didn't have any private hospitals. So my father started the hospital from scratch, 10 bedded, 20 bedded, 50 bedded, and then made it to 200 bedded, 250 bedded. All throughout my childhood, I used to see people used to touch my father's feet. He was also a surgeon, a trauma specialist surgeon. Used to treat a lot of gunshot wounds. So many lives he used to touch and many lives he used to save. So with that intention, I had a lot of empathy and sympathetic nature since all my childhood. So I always wanted to help people. And in that way, I used to visit my father seeing surgeries when I was like third or fourth class. So I was never scared of blood. I always wanted to help people. And what better way to help than to become doctors. But era since my father has changed, you know that. Now no more patients don't worship doctors as gods, which I feel they should not also. But even the respect has gone down quite a bit. And a lot of lawsuits are happening. So a lot of this generation has seen a lot of changes. But I enjoy being a doctor this time, and my journey as a cancer surgeon, I chose cancer, laparoscopy, because I wanted to be in touch with the advanced technologies, AI and laparoscopy, the advancement. Even I'm a robotic ready surgeon. I'm trained in robotic surgery from UK. So that is at the advanced part of it, and cancer everybody is scared of. So I want to help people where the people need the most help. That is why I became a doctor. But sadly, when my father passed away in 2017, when I started my practice in Allahabad, I came to know that doctor is one thing. Obviously, doctor-patient, you have to help patient, that is one thing. But patients are being unnecessarily stressed and uneducated about so many awareness health issues. So through that, I started my social media channel. So doing so many things, as you can already understand, and being a bird watcher also. So I've been a passionate. So one more thing, in the starting, I would say that if you would ask me who's my biggest teacher, so my biggest teacher I would say is nature, because my connection with nature is pure, serene, and nature includes everything. Nature includes birds, nature includes trees, nature includes a love for my planet, and obviously water.
Thank you so much for sharing this and setting up our conversation so beautifully, right? I would love to come back to your work around biohacking and your relationship with nature. I'd love to first actually talk about your current expertise, which is surgery.
Perfect.
Right? Why did you pick surgery? It's a very demanding time, right? And I think residency is notoriously toxic, a lot of hours. How was it for you? And do you regret in some sense taking surgery?
Never.
And would love to hear a little bit more about how it was for you.
So as I told you, my father was a surgeon, so that was the biggest inspiration. Seeing him save lots of lives made me took surgery in the first place. Then during my residency, I did my residency from Nagpur. Nagpur was a beautiful city, but as you rightly said, the residency period is very grueling, and we hardly had any time.
Yeah.
So that was same as my journey. But why I picked surgery? Because surgery, I could see that it's the field of action.
Yeah.
Like if you have the disease, then you treat it. If you
Yeah.
have piles, then
Yeah.
use the latest
Yeah.
technology of laser and do a sutureless, painless treatment for the patient, so he walks home.
Yeah.
If you have a gallbladder, you just remove it laparoscopically with minimal trauma to the patient. So these are all hernias, obviously. So there are some things which surgery is needed. For example, trauma. But I will take this conversation to a very interesting corner, which I think you might have not thought from that perspective ever. So when we talk about surgery, you know that the disease, I have to find a cure. For example, Rishabh Pant. Rishabh Pant suffered such major issues. Nobody in the world believed that he will play cricket. But that was the miracle of modern medicine, which made him so well that he's playing cricket for India. That is a big thing, brother.
Yeah, of course.
And after what he suffered.
Yeah.
So that is the miracle of medicine 2.0, if I may term it as in Peter Attia's Outlive. It's a beautiful book. You all should read about health and longevity. So this is just a concept.
Yeah.
I have incorporated my own concepts in that. So medicine 2.0 is the current medicine, which we are all practicing.
Got it.
So I started into surgery because I loved surgery. I loved saving lives. But then I realized, I'm connecting the story, that is why.
Yeah.
Then I realized that, for example, a piles patient comes to me, a young patient, lots of students studying in libraries, they are not able to focus on their hydration, their nutrition, and they, because of stress also, gut-brain axis, if you might know. So if you take stress, your guts worsen, leading to gut issues, including hemorrhoids and piles. So when a piles patient, young patient suppose, comes to me, my job as a surgeon, advanced laparoscopic and laser surgeon, is to, if in the beginning state, I can try and heal him with medicines, treat him with medicines, but otherwise surgery, laser surgery without sutureless. But does my job end there? You tell me. If a young person of 25 years comes to me with piles and I treat him, he walks pain-free, he's fine. Does my job end there? It actually doesn't. But for most of us, it ends. Because as doctors, as professions, it's our journey. We also have to earn money. We also have our families. You can't get too involved in a person's life. There comes the new concept of medicine 3.0, which all doctors, Ayurvedas, people, humanity in general need to adapt to. So I was telling you, all acute issues, the current medicine is best. But have you ever thought about so much technological advancements? Before coming here today, I had got my full AI screening test through a company called Noora AI. They did my full screening, and in 1 hour, all my CT, calcium scores. I'm an athlete, so I wanted to get all those tests done anyways. So were perfectly normal with the reports, everything in 1 hour with the help of technology.
Wow.
So that I'm saying we have to adapt to new technology. But that's what is been not happening.
So, there's this one school of thought, right, that today there's just so much violence that occurs in hospitals, right?
Yeah.
And one reason for that is because more often than not, patients come to the hospital or government colleges when they are already in advanced stages of a disease.
Correct.
Right? Whereas the alternate would be, what if they actually came in when it was a little bit more preventive, right? So why don't we start working more on preventive care?
That's true.
Right? What are your thoughts on that a little bit, on kind of how can we bring that level of preventive care and community medicine to our, maybe primary care institutes, right? And what roles can doctors, medical professionals play in that?
So I am playing my bit in that. That is where the power of social media comes. Because any person, you, me, even a person selling tea, means any social strata person is still using social media these days. And social media is the right platform, I think, to because most people watch fun reels, time pass reels on social media. I think social media is a brilliant platform, like this podcast we are doing. We are having a conversation. One thing is social media can inspire young minds. One thing, social media can give new ideas and obviously spread the right awareness, the real value of my channel, which I started. Well, and many other people, doctors, are spreading this right.
Almost every surgeon I've spoken to has had one case that really influences them and stands out for them, whether it's for its complexity, whether it's for the emotional angle. Do you have that case, and could you share more?
I'll share two different angles. One angle is like my most difficult, most challenging case. So that is, as a laparoscopic surgeon, I operated one of my father used to run a school also. So once the school principal got CA ovary, she was a very good human being, an English lady, a Christian lady, and she came with widespread CA ovary, cancer of the ovary. So we went ahead, we operated on that lady. Then we did lots of chemotherapies, intravascular, intra-abdominal chemos, lots of advanced things. This I'm telling a story of 5 years back. And we made that person recovered. Then we worked on her diet, and so she survived for 5 years, but after that she couldn't make it.
Sorry.
So this is one case which again makes me keep stressing the point that cancer is beatable these days. Cancer is nothing to worry about these days, but we have to act soon, and act soon in such a vast population of country like India. It can only happen if the people have the right awareness.
There's been an increasing level of, I think, medical legal cases against doctors, right? And today we are seeing a large percentage of graduates wanting to enter radiology, medicine.
Very true.
What are your thoughts on that, right? And what do you see the future of enrollment in surgery to be?
So true. I love this question because I have faced this journey myself. Being again practicing in Allahabad, it's a smaller place. So when I started practicing, I run a hospital apart from being a surgeon. So critical care part also I see into it. So people used to come, people used to fight a lot. As you asked the earlier question, people used to be very aggressive. Not just in cancer advanced diseases, but even in critical care patients. One important thing to stop for advices for doctors, which I have implemented, to how you can minimize these kinds of harshities and these kinds of lawsuits, is any critical care patients, any even cancer or pneumonia or any patients, tell the truth first thing. Do whatever the first interaction with the relatives has to be recorded.
Got it.
On a video recording, video counseling session. So this is a key point. If you because if any patient comes, he's critically ill, you explain to him that he's very critical state, we have to put on ventilator, he might survive, he might not survive. But if you record them in that video consent, obviously written consent is important to save the surgeon or in court, as you rightly said, lots of lawsuits are happening. So in written consent is very important, but written consent in the court, many of the times they say that हमको समझाया नहीं गया, we were not counseled properly, हमसे धोखे में sign करा लिया and all those things. So with a video consultation, under the guidance ki the person being counseled is aware that this is our video recorded and repeated of it. If it is critical, then again in the next 24 hours. This, I think, clears up all the issues.
There's also this perception that, DNB surgery trainees often have less exposure to MS, right?
Exactly.
Would
it's
love
a very
your thoughts
good question
on
again, very, very good questions. But I think it's the opposite. It's not the opposite. It's actually your mindset. Your mindset.
Fair.
The surgeon's mindset is to learn. He can learn in the worst of conditions. If his mindset is not to learn, then he can not learn in the worst of conditions. And as a professionalism, you have done DNB surgery or MS surgery, you can reach the same. The sky is the limit for everybody. I think really. And it's a matter of perspective and mindset. And obviously, exposure-wise, every hospital, private hospital, so it depends on the institution rather than the degree. For example, if you're doing a DNB from Gangaram, it is much more productive than doing a MS surgery from a lower side-placed government medical college.
No, fair. I think I love that. I think mindset is everything, right? And the way the lens in which you look at things.
Correct.
I think oncology is an evolving expertise, and the advancement of robotics, and I think the other technology levers that have come up, right? Would love to hear your thoughts on what you see the future of the field to be, and as an onco surgeon, if any thoughts.
There is one institution called as IRCAD in France. It is like the mecca of laparoscopy. If any surgeon who's into a laparoscopy, he must be surely heard about IRCAD Institute in France, in Strasbourg. So I've done a diploma in advanced laparoscopy from there also. So when I was there, this I'm telling again 4 or 5 years back. So we have so much advances now and technology. Like for example, everybody has seen CT scans, machines, MRI machines. So they have operating tables, CT, MRI inbuilt. And for example, there is a tumor in the liver and a surgeon has to go and cut the tumor out of the liver. You can incorporate CT scans, MRIs and make a virtual image on the person's body and you can virtually see the nodule and then you can treat it accordingly. So lots of advancements and I think it's going great. And robotic is just an extension of laparoscopy. I don't see a future. Obviously, there is going to be a future where robot will do the entire surgery. But till now, what robot is doing is just mimicking the human movements. So robotic surgery for general public is that a robot is not performing the surgery. It's being done with the help of similar instrument than laparoscopy, but the surgeon doesn't stand next to the patient, and laparoscopic instruments are like coupled into a robot. And the robot surgeon sits on a console like we play video games, and we just move our wrists, and the robot moves those arms meticulously and performs the surgery. So that is what robotic surgery is. The future, whether it will be fully robotic, is the same future as whether the cars will be fully driverless.
Fair.
And it is going to happen. That is also going to happen within the next 10 years.
From a career satisfaction and a financial standpoint, which super specialty in surgery would you recommend for the aspiring, surgeons out there who are, hearing you and getting inspired by you?
Oncology is a great field. Gastro is a great field. All is a great field, I think. And one thing it has to be made in the minds clear of the audience or young doctors, as that just follow your passion. And do what you want to do and do what you feel like doing. Don't do that because I am doing that. Don't do because you are doing that. Don't try to, you should get inspired, but follow your own journey. Because on the rocket, on your personal rocket, there is a seat for you. And your name is written on you. This is again the play of the mindset. I'm not joking. The seat has your name. What you have, it is, nobody will steal it from you. The competitive exams and our community has made it so difficult these days that we are all fighting ki we have to study, otherwise wo meri seat chali jayegi. So that is the bringing the mindset down. Even after so much effort, a person gets MCH gastrosurgery. But why are you not asking about so many suicides happening in medical doctors? Because life is so much stressful. There is no point of being a doctor if you can't take care of your own health. If you can't be mentally balanced yourself. Because doctor has to give and affect and influence and save and touch so many lives. But he or she can only do that if he himself is calm and balanced inside.
Super insightful. So doctor, you mentioned, right, you run a 200-bed hospital in addition to have a thriving practice, in addition to doing a bunch of other things. How is it like to run a hospital? What are the challenges? What are the obstacles? How do you manage fellow doctors and fellow medical professionals? I get the administration of running a hospital may be pretty complex.
It is very, very true. And to run a hospital in Bombay, it must be a different altogether ball game because it's here all corporate institutions only survive. To run a family-run business hospital in a place like Allahabad is very, very difficult and very, very challenging. So again, we have to keep building make the team as a family and care about each other. Keep motivating each other, make our fellow doctors, as you asked, comfortable. In that, Knya plays a big role because in our working environment, if you wear the right clothes, especially the newer scrubs, they're anti-sweat, and even in cold winter, I enjoy working in it. Sometimes I shoot my reels. Why did I start shooting my reels in Knya? Because I was just comfortable. And comfort for doctors are so much important, which most of us ignore. So make the environment of for example, my 200-bedded hospital, 300 staff is there. So just I try to make the atmosphere comfortable. But humans are not that easy to manage, you can understand. To manage such a big crowd is challenging. So it's a process. And so I do that by balancing myself, by connecting to nature, and that is where the blue mind part of my journey comes into the place, which is so essential. Otherwise, if I'm not balanced, then how can I spread awareness, do anything, do surgeries, be mentally balanced, take care of my family, follow my passion of bird watching.
Actually, my next question is about how do you manage balance, right? And because being a surgeon, managing a business in some sense, and kind of living your day-to-day and having all the responsibilities. So how do you really manage balance? Would be curious. And what does balance mean to you?
Balance is the key to life. Everybody knows. So if balance is, I rightly said, I just follow my passion and stay connected to the universe. I am very spiritual, but I may not be that religious. I worship Hindu gods. I respect them a lot, but I may not be spiritual. So there has to be some faith, which has to be the backbone of you to stay balanced. Spirituality is mine. Being balanced, being connected to the universe. And that means different thing for different people. For me, The balance in me is brought to be by water.
Yeah.
I owe my life to water. I feel that everything going forward is water, and how water flows. If you have read the book Be Water, My Friend, Bruce Lee. That's a brilliant book, how to keep yourself balanced. So that is how I keep myself, by staying connected to nature, by doing bird watching, or staying that is how I can stay in balance, and that's the key.
Super. Would love to actually, move gears a little bit and talk about the work that you've been doing with wildlife photography, right? I think it's pretty commendable. I think you were sharing with me, you share a calendar every year with Times of India and a couple of other,
WWF also.
Exactly, with WWF as well. Would love to share more how you got into it, how do you take time out, and a little bit more about the passion.
Surgery for me, and bird watching and water, all things they unify. Because if you, as I told you earlier only, that my biggest teacher is nature. Nature taught me patience, nature taught me perseverance, nature taught me to stay balanced, nature taught me to keep doing what you intend to do,
Correct.
to pursue passion. So that's how I balance it, everything. I just keep following my passion. And obviously you have to be in flow in life. How do we achieve flow in life? That's a good question which people should know. So in Blue Mind only, there is one concept, how to achieve flow in life. There are a 4-step process, very simple, everybody can do it. Number 1, you have to be doing something which you love. For example, I love laparoscopy surgeries, I love photographing birds, I love doing underwater meditation, scuba diving, whatever. Somebody may love to play a piano, somebody may love to do anything, run, like I'm a marathon runner as well. So number 1, you have to be doing something which you love. Number 2 is, you have to have mastered the skill in the past to be doing that activity at a subconscious level. Like running, you have to have some training behind it. Laparoscopic surgery, you have to have some training behind it. Being a surfer who's surfing on the hardest wave, they have to have some experience. So number 1, do something which you love. Number 2, you have to have some skill, mastered the skill to do it subconsciously, like we do walking. Number 3, there has to be some challenge. And that challenge should not be too overwhelming, but it has to be a challenge. For example, for a surfer, a biggest wave is his challenge. For a surgeon, if I do, and a difficult case of endometriosis comes, where everything is stuck, I cannot understand, that is my challenge. That is where my mind has to work intuitively and instantly, that time. If you do all these 3 steps, you get to the 4th and the most beautiful phase of flow, that is loss of sense of passage of time. And I'm sure each one of us has experienced that some or the other time. Like, I think like we are in flow right now.
Yeah, absolutely. I know you've spoken about it a little bit as well, but would love for you to talk a little bit about what biohacking means to you, what motivates you to kind of be a biohacker, and maybe spend a few minutes on it. The reason I ask is because I think one thing we've consistently seen is medical professionals burning out, medical professionals having serious mental distress, physical distress with the long hours.
We touched on it a little.
Exactly. But I think maybe your journey in biohacking could inspire other medical professionals in their career.
I think, again, mindset shift is required. We all are biohackers. All doctors, all people who think about their own health is a biohacker. So start calling yourself a biohacker. I just read about it. I'll tell you in brief. Biohacking is what? Biohacking is connecting to your inner self.
Correct.
And living and trying to be the best version of yourself, not just physically, but even mentally and spiritually. That's what biohacking is. Eating the right food is biohacking. Drinking the right water, keeping yourself cellularly or the right amount of hydrated is biohacking. Going to the gym is biohacking. But considering exercise from the wholer perspective, not exercise is cardio, weights and flexibility. It's not one of them, it's not either or. So understand. So basically being a master of the pillars of longevity or pillars of the health is biohacking, which just in a nutshell I'll tell down. Number 1 is the nutrition, what we consume. It also includes hydration, how much and how well we hydrate ourselves. Number 1 is nutrition and hydration. Number 2 is movement. Movement was a natural part of our lives. We messed things up by creating this artificial world, the real world which we live in. So we have to invent exercise. And I already pointed out exercise or movement had to include everything. The cardio, the weight training, very, very crucial, and flexibility. This is the second pillar. The third pillar, being an overachiever myself, doing bird watching, doing so many things. I was also ignoring till a couple of years back when I read the book Why We Sleep
Wow.
by Matthew Walker. If you read about it, you'll go nuts because sleep deprivation, ideally everybody should be sleeping 8 hours a day. Even to doctors, I'm telling, and sleep deprivation of 2 hours is worse than consuming tons of alcohol. And it in the long run, if you are sleep deprived, my story as we discussed doing when I was doing my MS, I used to sleep 4 to 5 hours, and I used to be fully fresh and feel like I can do everything I can do. But no, in the long part, up to your 30, you can do that.
Yeah.
But beyond 30, I would strongly advise everybody to focus on their sleep because 1/3 of our life is sleep.
Wow.
And what DNA repair mechanisms, everything happens in our sleep. Our gut resets, our liver resets, our spleen does so much important work, which if we don't give them the time, they'll not do the work.
Yeah.
So this is the third pillar. Fourth pillar is the mental balance or meditation. But I will not term it as that meditation. As scientists, we should call it as non-sleep deep rest. It's a meditation protocol. But it's different from meditation. Anybody can do it. No, you don't have to learn it. Just type NSDR. It's a famous one is by Andrew Huberman, whom I follow a lot. You must be all aware. He's a big longevity guy himself. So you just do 20 minutes, and suppose you haven't had a bad night's sleep, do an NSDR session, non-sleep deep rest, and you will be recharged.
Yeah.
Also, blue mind, connecting with water is a big way of meditation.
Yeah.
So what all these things done, these are the main 4 pillars. The fifth pillar, if I'll jaldi say I'll hack is preventive, proactive health, including AI, including technology, do the best tests possible, and get ahead of the game.
Fair.
Get ahead of the disease.
Fair.
Medicine 3.0 concept again.
Fair.
And 6th pillar is social connection, human connection, love, care.
Very important.
So if you master all of these, blue zones, have you
Yes.
you know about the blue zones? There are 5 identified blue zones. I happen to be in Loma Linda in California when I was in Vegas.
Yeah.
That's in California. There is one in Italy, one in Japan, and Okinawa, and all those. So they have a great sense of community. They even drink alcohol. So there were studies done that is moderate amount of alcohol good for health? But obviously it is not. But I'm just trying, the moderate amount of drinking of alcohol can be balanced if you live in a harmonious community and a non-stress mind.
Got it. I'd like to take a step back and actually speak a little bit about your surgery days. Any advice for young surgeons, right, who look up to you as they are kind of looking to pursue surgery? What kind of mindset should they have to take up surgery? And in addition, if they want to super specialize, right, as we discussed, how should they think about it?
First thing, I already pointed out, follow your passion. If you have decided that surgery is your passion, do it.
Yeah.
Be adaptable to change. Be
Got it.
adaptable to new learnings. Learn new technologies. Don't be stuck in the old mindset.
Fair.
And learn laparoscopic surgeries.
Fair.
Learn to go to advanced centers. Be robotic ready. If in this generation, if a surgeon is planning to do a surgeon, if a young doctor, then he should definitely think of, your mindset has to be there. Your mindset cannot be just become a laparoscopic surgeon or a simple surgeon and just keep earning. Again, if you with that earning mindset also, you can make a happy life, you can live, but this way you will have a more fulfilled life.
Yeah, no, I agree. Absolutely. Well, doctor, it's been a real pleasure, speaking to you, and I think I've personally learned a lot. I'm sure the audience would have learned a lot as well. I'd like to kind of wrap up the conversation with a quick rapid fire. Post that, would like to pause and probably answer any questions you may have for me or anything else that we've missed here. Right? So quickly, if not surgery, then what?
Surgery only.
One surgery you can perform even in your sleep.
Any surgery, laparoscopic hernia surgery, laparoscopic gallbladder, laparoscopic, any laparoscopic surgery.
Open surgery, laparoscopy, or robotics, which excites you the most?
Laparoscopy is now, because robotic is not accessible, but robotic is fun and I really want to do a robotic, but the issue is feasibility in our country.
Understood. The most underrated surgical specialty?
That's a very interesting question. Surgical specialty, I think it should be gastro only, because gastro people don't understand, and the important thing here is to integrate the new concepts of gut health.
Yeah. One misconception people have about surgeons?
That he doesn't care for the patient, and he's very fast. One misconception I think people have for doctors is that he doesn't give time. So this is one thing to all the doctors, the young doctors. See fewer patients, but give them proper time.
Fair.
Don't let
Good
them
advice.
their question get unanswered, because they're coming to with so much hope. And if you just fatafat see them and send them, they have 10 questions which will feed their anxiety and will not give the results.
Yeah. The longest surgery you've ever performed?
8 hours. I was in Mamsi, Maulana Azad. A person had iron rod through and through, and it had perforated 8-9 bowel places. So we managed to take the rod out. Hadn't pierced any major arteries, so we could save the patient. I was a SR then in Mamsi, Maulana Azad, Delhi.
Wow, super. One thing surgical residency doesn't prepare you for.
Mental resilience. Work on your HRV. Work on your VO2 max. Work on your own fitness. Work on your own mindset. Follow your own 4 pillars.
Yeah.
Because this nobody teaches you. And gut health. The important thing about gut health is, as doctors, nobody teaches us in depth. Study the gut microbiome now.
One non-medical skill every doctor must learn.
Communication. Be on social media. Talk to people. Teach people. Whatever you want, have your skills. Just explore and just have group meetings. Have just fun discussions about new things. Keep learning. Learning is neuroplasticity is one big word which I've made a lot of reels on recently. But neuroplasticity is what? We used to believe that our brains don't grow. But our brains can grow. Brains can adapt at 40, at 50, at any age.
Yeah.
You just have to engage in neuroplastic activities.
Yeah. And finally, what does Knya mean to you?
Kanya means comfort. As a surgeon, I think that's huge. Because comfort is everything for a surgeon. When we are saving lives, when we are performing longer surgeries, if you're not comfortable, then you can't give your 100% to the patient. So Kanya means true comfort, and brilliant work by Kanya people. I would like to congratulate the founders, the company, the theme, and how you have brought and made this community of young like-minded doctors, and how we have started doing this podcast. I think we should do it regularly.
Yeah.
We can do one on extensively on gut health.
Got it.
Personally, if I want to.
No, of
because
course, thank you.
I've dived too deeply into gut, and in such short conversation, I can speak 1 hour on just gut and the intricacies of gut health.
Yeah. Well, it was an absolute pleasure, doctor. Thank you so much for your time and, coming here in an afternoon and spending it with us. We learned so much, and I'm sure the audience would have learned a lot as well. So that's it, guys. An incredible episode with Dr. Arpit Bansal. We learned so much about multiple topics around laparoscopy, surgery as a branch, biodiversity, biohacking. It was an enthralling conversation. Please like, share, and subscribe. And please watch this entire conversation. Reach out to Dr. Arpit Bansal. His details will be below in the description. And thank you again for watching.